What's up, y'all? Welcome back to another episode of the NLB Pod. I'm your host, Dr. Farimang Touray Jr., and I'm coming back with our bounce back series. Last time we covered the ankle sprain, something really common. Today's going to be a little more of a broader component. We're going to fit a couple different diagnoses into this one, but it's all about the knee. And we're going to be talking about three different scope diagnoses, let's say, or categories. One, meniscus. Two, ligamentous. Three, tendons. Three of them more, we'll go four, and we'll make it four at the joint level, at the knee joint level. More for the more of the common things that you see. And the approach is kind of similar in aspects, but it just depends on what you're dealing with. So we'll start with the meniscus. Meniscus, think of it as people like to talk of it as like a shock absorber, of where when your femur is where the thigh bone is about to make contact with the shin bone, and think of them there being like a little cushion there in between those two bones to not allow the force from up high or the force from down low to come into the knee. So you have something to kind of disperse the force instead of it all going to the knee joint or to the knee bones itself. So that's what the meniscus are. They also um, work to protect, like lubricate the knee, help it move a little smoother. But depending on where you're at in the meniscus, it can depend. There's not a lot of blood supply that goes there. It gets its blood supply from synovial fluid around the knee joint, around the knee musculature. So in terms of just it's a very important structure because if we didn't have it, the amount of force that goes through the knee joint like when you're jumping, when you're landing, when you're running is really high. And if we didn't have it there, it would just cause a lot more, you know, stress to the bone. We'll call it that. A lot more stress to the bone. So when a meniscus gets injured or gets altered, what there usually is like some kind of twisting kind of motion. Your foot is planted and you twist your upper body or hip some way, and that can just catch on the meniscus and t cause a tear. Now, depending on where the tear is, how big it is, if it's causing pain, if it's limiting function, that's going to determine what kind of procedure, if any, needs to be done on it. Now, there's a lot of research now to show that you can have a meniscus tear and have no pain, or you could have no pain, or you could have a lot of pain but not have um, any meniscus pathology, and then it's like, is surgery worth it? Is surgery recommended, or is non-conservative care recommended? And my approach, I'm not thinking maybe I'm biased in this, but just based on the literature and the research and what it shows is like there's not too much of a difference between getting surgery and getting a like meniscus repair or a meniscectomy, where basically they take out the meniscus. If it's in a place where it's not enough to repair or they don't think it can heal on its own, then they just take it out. And that can lead to other things down the line. But if you repair it, basically you're off your think of something like Jerry McCain. That's what happened to Jerry McCain. He had a meniscus repair, so because of the nature of the repair and depending on where it's at, you're not allowed to put any weight through the knee for 6 weeks, usually 6 to 8 weeks, depending on how you're recovering. And then you got to work on the range of motion, and they slowly allow you to ramp up to more and more range of motion. And then you have to start thinking about strengthening everything and getting back to a pre-baseline level of function. So it just takes a long time. It takes a long time to build strength. It takes a long time to build the motor control and the confidence back in your leg to know that it can handle all your movements, all your decels, be able to react appropriately to the person in front of you, person that you're guarding when you're help side and when you're on offense trying to make moves and make things shake. So meniscus. Very, very tricky one, but very important to make sure that the right plan of care is being implemented to help players get back and not have any lingering or long-term setbacks. Number two, I said ligamentous. So Common ones that you might see are an MCL, which runs on the inside of your knee, and ACL. You hear about the ACL all the time, which is kind of connects the shin bone to the femur and stops your shin bone from going too far forward and rotating too far. So, we'll start with the MCL first. Usually, this is going to happen if you get hit on the outside of your leg and there's a force coming in towards the middle of your knee. So you have some kind of big force, someone diving for a ball, they run into the outside of your leg on accident, and it causes your knee to kind of go in towards the other knee, and that can just put an increased stress on the MCL. Now, depending on the severity of it, if it's a partial tear or a full tear, is going to determine your recovery timeline. Obviously, the more damage it is, like if it's a complete tear, it's gonna likely require surgery. You're gonna be out for several months. And that's the nature of the beast of just getting back that stability and the control and the strength to make sure that you're able to do what you got to do. But that's a long process in and of itself, 12 to 16 weeks plus some plus or minus several weeks just based on like the nature of a full MCL tear. But if it's a sprain, you're probably looking like at a anywhere from a 2 to 8 week period, depending on the severity and depending on what you have access to and depending on how frequently you're doing your rehab. When you think about some of these NBA guys, they have access to a healthcare team around the clock. They have access to treatment around the clock. Whereas someone in high school is not going to have that kind of access. So it just depends on what kind of information you have access to, what you're doing before, in the meantime to help yourself recover. But that's why I'm here to give the information as if you're working with a pro, but just trying to make it sure that everybody understands what's happening, and not doing things that are going to set them back. And a lot of times it's just like rest and wait till things feel better, and then go try it out, and not really having a game plan. And then when we go to the ACL, that's just straight up, that's you're out for 9 months at the earliest, looking closer towards a year. Like just if anyone tells you that you're coming back in 6 months, go see somebody else. Especially as like young hoopers, there's too much growing literature out there that if you come back too early, your chances of re-tears are very, very high. And it's just, I don't think it's worth it to try and rush coming back really soon just to have the chances of another one happening again on the same leg or on the opposite leg. It's not worth it. So just have in your mind, if you have an ACL, a confirmed ACL tear, you're out for 9 months at the very least. That's when I will entertain a recovery timeline. So just keep that in mind. It's a long process. And it's also going to depend on if there's any, MCL damage, if there's any meniscal damage, that's going to change your timeline as well. And I understand everyone's different, but I will say for a fact, you're not coming back before 9 months. And that's okay. That's okay. This is a long process. There's a lot that goes into just um, what's happening anatomically in the knee, but also there's a whole mental aspect of things that I don't think we talk about enough of now you're struggling to just get up and go from your bed to your bed to the bathroom. Now you can't put any weight through this thing if there's meniscal involvement. Like your way of life has suddenly changed. You're crutching around, um, going really slow, and the game the sports that you enjoy have now been taken away from you, and you're having a hard time mentally dealing with that. Like that's tough to be able to do whatever you want to do, be fortunate enough to be able to do whatever you want to do, and then suddenly it's taken away from you, and you're not able to compete in that, participate with your teammates, participate in, your stress reliever and your dreams. It's gut wrenching. And that takes a long time to build the confidence back to know that, hey, I am good enough to get back on the court, contribute, be back to the player I was before or better. And then two, have the confidence that it's not going to happen again. You have to believe that. If you come back, and I tell people this all the time, if you're coming back from a serious knee injury and you feel like and you weren't wearing a brace before and you feel like now you have to wear a brace, you're not ready. Straight up, straight up. You're not ready. If you feel like you got to wear a brace coming back to sports, you're not ready. Mentally, you're not ready yet. There's something that you know that just doesn't feel right, that you don't feel confident with, and that's okay. But it's our job to make sure that you feel comfortable getting back to who you were before, even actually better than who you were before, because you were a totally different person before something like an ACL injury occurs. And now you have evolved to a new person and overcome a lot of adversity. And you've had to show a lot of resilience and show a lot of mental fortitude to be able to go do the boring stuff every single day, the stem on your quad, working on your range of motion, working on your core, working on your hip, working on your calf, working on getting yourself back to the player that you know you can be, the player that you have in your mind before the injuries began. That's the task of doing that every single day, every single week for at least 9 months is a long time. And there's going to be setbacks. Probably. There might be some things that flare you up that increase pain when you thought you were past the pain phase. And just know that it's part of the process. But overall, as long as you're trending in certain directions and having ways to assess your progress, assess the little wins, be mindful of the little wins, because those are what's going to be what you're stacking to help take you from here to here to here to back to where to back on the court to back to practice to back in the games. So ACLs are tough. Find a physical therapist that you like. Find a team that you like, that you enjoy, that you know you don't mind spending time with, because it's a long process. So just heads up on that. I think it's very important to set expectations and set guidelines and set parameters and set stages of this is what it's going to look like. This is what I'm expecting from you, side to side, knee to knee. But we're not just going to be going half effort at it. This is something that if you're trying to get back, this is what it's going to take. So that's something I like to set from the beginnings of so everyone's aware of what it's going to take. And I think, it's just finding people that support your journey and your goals and surrounding yourself with a good team of people like that. And because you're going to deal with a lot of negativity and some negative thoughts, which I think is normal, but it's how do you use those thoughts to help you see the other side and get to the other side. That was a lot, but these injuries are complicated, and I'm trying to give you a brief overview, but there's a lot more that goes into it that I think is important for players to understand, players who are going through it to understand, to help with the whole process, this whole rehab process. Then we'll talk tendons, common ones, patella tendon, quad tendon. Sometimes just as we're growing, as our muscles are growing, sometimes we put a little more force, so we're doing a lot of jumping, landing, running, changing directions. We just put a lot more force than maybe our tendons are ready for, and that can just lead to a little more irritation at the tendon. And that's, not fun because sometimes it's like you can rest a couple of days and you're straight. Other times it's like every time I get up in the morning and I go up and down the stairs, my knees are killing me. Um, and especially as you're growing into your body, as you're growing into like who you are as a person, it's just annoying to deal with. So a lot of tendon rehab, how we go about it is just a lot of it is just like figuring out what are your pain points, what makes this pain worse. Let's figure out what those are. Is it a certain amount of jumps? Is it a certain time in the morning? It feels better as you get going. Is it when you've been playing for 30 minutes and the 35th minute, that's when it starts to hurt and then it just lingers for a while. One is just figuring out what are the pain points? And two, what do we need to modify? If you're training, do we need to take out jumps for now? Just work on isometrics where the muscle is moving, is contracting, but the joint is not moving. They tend to respond, excuse me, relatively well to isometrics at a high enough intensity. And then figuring out, okay, isometrics are progressing well, feeling well. Then we start to go slow tempos, down slowly, up slowly, getting the joint to move through a shortened range of motion and slowly increasing that range of motion. Then we bring back some of the quicker things, some of the jumps, some of the landings, working through short contacts, long contacts, getting you to feel comfortable with all of the approaches, all of the contacts, all the jumps you might make, and then returning to sport. So that's a real quick overview. We did an episode on patellar tendinopathy earlier, so if you guys want a more in-depth explanation or in-depth insight into what that looks like, go check that episode out. But tendons are tricky. They take some time, but I think a lot of it is how you load it, how you're loading it, and making sure that you're loading appropriately and not loading too much, because a lot of the times it's like you're doing a lot of stuff and your body's just not prepared for the amount of impact. So the amount of contact that you are placing it through. Not that it's bad, it's just what it is. So we just gotta make sure we are educated about what's going on and then load appropriately, figure out what are the aggravating things that make this thing worse, and let's stay away from that, but also keep that in mind for when we get further along. It's like those things that were aggravating early, are they still aggravating now? And they shouldn't be. So, quick overview on tendons, and if you want to learn more, we did an episode on like patellar tendinopathy, so go check that one out. And then lastly, we'll talk about just something joint related, pain in the joint. It feels like it's in the, a lot of people like to describe it as it's deep in the kneecap. And when you bend it to a certain extent, that's when you start to feel it. And a lot of that is just like as you're growing, you're gonna feel used to your new body, and you're gonna like usually like just like you're just growing at a rate and your body's just adjusting to it. So it's figuring out how do we work on like mobility and strength at those end ranges and feeling comfortable with that as pain starts to come down. How do we make sure you're comfortable with that? How do we work on, just overall extensibility or mobility of your length of your tissues? Make sure your tissues aren't stiff, but they're pliable, they can move, they can kind of glide smoothly and not feel like they're pulling on the tendons and pulling on the joints. That's a big key, having access to those end ranges and being strong in those end ranges. And then the other musculature like the hip, the calf, the foot, making sure the mobility and the strength is there to offload or change your patterns of where you're loading through your body. So that's a quick overview of the four common areas that I see as a physical therapist, and just some things to keep in mind as you're recovering. We did a episode on, kind of what the four stages of tendon rehab looks like, because that's a big thing of what I see, especially in jumping athletes, whether it's basketball, whether it's volleyball. And just I think there's a lot of misinformation there about, you just gotta rest a hurt knee or hurt tendon, and then give it a couple weeks and you can go back to the same levels of activity that you were doing before. And I think that's very dangerous to put out to the world, because I feel like if you just take a break completely and then you ask yourself to go back to the exact same level of intensity, your body's not prepared, your mind's not prepared. You haven't got a feel for what that's like in a couple of weeks, and I'm asking you to go rev the gas and you don't got a lot of horsepower in the engine, then I'm setting you up to fail. So I think it's just important to have good information on this, and it's changing. It's going to continue to change as more research comes out, but it's just important to, for me to just stay on top of as much as possible of what's going on in terms of injuries and what's the best, how do we recover faster? How do we recover better so that we can, keep doing the things that we enjoy? So that's what I'm on. That's what my job is, just to make sure that I deliver the information to y'all so that you guys are as educated as possible about what's going on. And I really just want you to be invested in your own health. Ask the question that you need to ask to make sure that you're doing what's best for you and your body. And if I don't got the answer for it, I'm not gonna have the answer to everything, but nobody is. And that's where it's on us to, take a step forward and make sure that we are doing what we can to stay as up to date as possible, stay as educated as possible, and then disseminate that to the people who are coming up next and people who are dealing with these things to give them the best outcomes possible. And on that note, appreciate y'all listening. We'll catch y'all on the next one. Peace.